just wait a couple more minutes until, because we said 4.
So we can hear okay through these masks, I hope?
If you could use the microphones when,
Yeah, we put the mics there, so.
Test.
You heard it different because it came up this way, nasopharyngeal passage. We heard it coming this way. Was the reference?
It was even better. There are a lot of resources on that phone call.
Dr. Bleicher, we'll just have you in just a second introduce everybody and say the opening. Okay?
They can introduce themselves, right?
Okay, you can start.
Welcome to Wyoming Medical Center. I'm Dr. James Bleicher, the interim CEO.
I'm Dr. Mark Dowell, an infectious disease doctor and Natrona County Health Officer.
Dr. Dunn, Chief of Staff and Chief of Primary Care. Dr. Ghazi Ghanem, I'm the infectious disease physician and Natrona County Health Officer.
Anna Kinder, Executive Director of Casper and Natrona County Health Department.
Okay, thank you everybody for coming, and hello on Facebook Live. We wanted to do a conference today to let the community know what was going on with this hospital. We called what's called the Code Orange this morning. At 6 a.m. we had 149 patients upstairs, which puts us at near capacity in having all private rooms. And we had 17 people holding in the emergency room. And most people here that have been here for a long time have never heard of that many patients holding in the emergency room. We have been dealing with COVID, as all of you have, since March. We had a census of around 3 to 4 for most of March and April of COVID patients, which were intensive care unit patients. That number over the summer drifted up to 6 to 8, maybe up to 10, but mostly 6 to 8. And over the last few weeks, that drift has become exponential. We've gone from 12 to 15 to 16 to 21 currently. Based on the 14-day and 7-day positivity rates and what's happening, we expect this to continue. We are the tertiary care center for the state, for the area. We've been on red, which means diverting for people outside of our county, except for we continue to accept traumas, STEMIs, which are heart attacks, and strokes, which we will continue to accept those, but we are on red status for outside the county for transfers in for tertiary care. So we called the Code Orange so we could pull all of our resources together and had our EOC this morning, and our ED is holding just a few patients at this time, but 4 o'clock usually is the witching hour when they start to get busy again. We know of more COVID positives within the community, so we do not expect this to be a 1 or 2 day spike. We expect this to continue to be an issue over the next 4 to 6 weeks at a minimum. So that's why we called the conference today. I'm going to turn it over to the physician experts here to talk a little bit more about what's been going on in the community.
Back in March and April, we talked about our concerns about the fall, schools opening, and this kind of thing. And this is not only bearing fruit, but earlier than we expected. I want to compliment the school district for the hard work they've put in sticking with a really great program that was coordinated with Anna at County Health Dr. Ghanem worked really hard with them. They're doing a great job. This is not going to go away for the next several months. I think it's going to get a lot worse. I think our hospital is already stretched, and we're not even really seeing the amount of COVID we're going to see. Remember, what we're seeing now is an illustration of what went on 2 weeks ago in this community. And what you're seeing now is going to bear fruit in 2 more weeks, because one case typically spins off 3 or 4 additional cases. So I think we're going to be stretched very thin at the hospital. We have a tremendous plan in place, great communication. There are some things we need this community to do now. We need everyone to mask in every business. Everybody that goes into the business and everybody that works in the business. No exceptions. We are asking the public to do this. We talk about how we're one big community in Wyoming. This is your chance to show it. This is not fake news. This is nothing like that. This is the real deal. We can control what COVID does in our community to a large extent if we do the right thing. Our schools double down on what you're doing when you're masking. If you're in close spaces in our community, ask yourself why. Socially distance, put on a mask. Ask everybody around you to put on a mask. Masks work, social distancing works. There is not going to be a vaccine for several months. I promise you. And so that's not the way we're going to live our lives right now. When it comes, great, but it won't be here. Everybody has mask fatigue, but we have got to do this. 20 people in the hospital with COVID is the tip of the iceberg. You're writing your own story in this county. If you mask and you do everything for everybody else's health, we have a chance to get this under better control. But if we continue to not mask and not do what we're recommending, we're going to get into bigger and bigger trouble. I promise you. And I commend what county health has been doing under Anna's leadership. We're working with the state all the time, and I think that's evolving into some perhaps new policies. But I want to ask the community to do something else. Contact tracing so we can get accurate information about what's going on in this county is incredibly important. You're not getting called because we're trying to check up on you and send your name over the internet. What we're trying to do is keep the community healthy, trace where this is going, try to help people stay well, and keep it from spreading. So for those of you in the community that refuse to answer the phone calls and cooperate with contact tracing, you're hurting your own family, you're hurting our ability to take care of people, you're hurting your friends. So do it for the good of the community and the state. Cooperate with the contact tracing every time. We need the information, we need to help. These things I'm talking about will help us keep our schools open and our businesses open. Because if we don't do this, we're having employees here at the hospital have to quarantine. We have employees getting sick, physicians getting sick. This is really a big deal. So I'm asking the people of Wyoming, and I'm certainly asking people in Natrona County, do your part, take it seriously. This is not political. This is a health emergency only. Take out the politics completely. And I'll turn it over to my colleagues. Thank you.
We have been preparing for this since March. We knew this was coming, like 1 or 2 weeks early, we knew it was coming. The hospital is ready. The hospital has been working on contingency plans, lots of other ideas outside the box to keep things staffed at a level, treat patients at a certain standard of care, and do the right thing by the community. So the hospital is ready. The outpatient world is also ready, have been ready with public health, Natrona County Public Health, the Respiratory Systems Green Clinic, all the other primary care clinics in town. They're up testing, advising patients. And just to echo what Dr. Dowell just you mentioned, we have a couple things on our side still. Masks, we said enough. Distancing, keep the social distancing. And don't go to work if you're sick. Get screened, get tested. There's some simple things that we can do to prevent a steeper incidence slope. I am proud of what the hospital's been doing, the partnership that's with the outpatient facilities in the county, as well as with Banner Health. So we'll work the problem, we'll get through this.
So, I think the message has been very consistent, and I'm just not gonna reiterate the same thing. The one thing I wanna point out is like, yes, you know, you can have 20 COVID patients in a hospital, and those 20 COVID patients are the tip of the iceberg, as Mark said, but, what that means also is like, you have a lot of people that are gonna stay probably in the hospital with this disease for quite some time, taking away beds that usually are used by other, for other illnesses. So when someone's gonna look at the number and say, oh, it's only 20 people, what is 20 people? That strains resources because it takes away from others. The other thing that we also need to be very clear about is that the staff can get exposed. Our staff, our medical staff can get exposed to COVID if someone comes in and do not disclose that they have been exposed themselves to COVID. And COVID has been really very hard. You know, you can have people coming in with no respiratory symptoms, and they can have it, and they get tested later. And this is really resulting sometimes in our staff having to quarantine. It's very important to really work with Anna and the group down there at the health department when they call to actually answer the phone and to actually help with the contact tracing. Yeah, we do have medications at hand. Yes, we know how to deal with COVID much better than back in March. But I mean, it's a tremendous challenge for us, and it's gonna get worse. We actually just, you know, had this meeting this morning. We decided this is the time really for us as a community to really take action. This is a call for action for the community.
So the only thing that I would add is from a community perspective, we know that it is community-wide spread. It is in our long-term care facilities, our assisted living. It is affecting our first responders. So even some of our businesses. So even though if I take all the actions that I can do to protect myself, when you consider like businesses and healthcare facilities that we have out in the community, if someone does become exposed to COVID or in fact is diagnosed with COVID, that takes that person out of the workforce. And so people are getting spread extremely thin. We're not able to do some of the work that we may otherwise. Imagine if we lose a whole group of firefighters or our dispatch or our police or some of our instrumental businesses that we have in the community. It may not be that the person is sick with COVID, but it can take out a whole business or a whole department. So I think that's what we're seeing at the health department. We are asking, as all of these guys have said, to please answer the phone calls, give correct phone numbers. The contact tracers can't do their job and slow or reduce the spread if we don't have the ability to contact people. It is very concerning since March. One of the factors that the health department always considered is what the hospital was doing. When I got out of my vehicle this morning, I had a phone call, and today was the day. So really working to, as partners, we've developed amazing partnerships in the community, and I think we can pull together and get through this. It's going to take all of us, and we need the public's help as well.
Just want to add that we're very lucky and proud to have this level of expertise and how closely they are working with us. And as Dr. Dunn mentioned, we also had an EOC call with Banner, who has quite a bit of experience with this because they surged in Colorado in March and April due to a meat packing plant. And then early this summer, they surged in Phoenix, where they have multiple Banner hospitals. So we have all of their resources to bring to bear and their experience, and they're helping with us as well. And as we all said, we're a community resource. We want to be here for all the people in Natrona County that need health care. And one of the first things this morning we had to do was pause our surgery schedule to make sure that we had room for those patients. We did, and we moved ahead, but we have to watch that closely because while we can control who comes in from out of the county by being on red, we can't control who gets sick in the county. And we have to be there. We are your resource. We need to be here to take care of you. And if we're filled with COVID, it's going to be more difficult to take care of the heart attacks and the strokes and the aneurysms and the sepsis and everything else that goes with that. So the better we can improve things in the community and reduce the spread, the less patients we're going to have in here. But to use a phrase, the cat's out of the bag. The COVID, as Dr. Dowell mentioned, what we're seeing is from 2 weeks ago. So what we're going to see over the next 2 weeks is from so going forward, if we can do much better now, that'll help us a month from now. But if not, this will continue. Our prediction was 30 by the end of the month. Now it's probably going to be 30 before that. And then we'll go to 40, and then we'll go to 60. And that's taking up a lot of beds.
And just one more point. Frontline heroes, heard it all over the place about medical professionals, and truly the frontline heroes are the community. It's what you all can do for each other, hold each other accountable. The hospital's going to be here for you all. We have plans in place, and we need you all to keep doing what you're doing in terms of the mask, everything that we've mentioned. You guys are truly the frontline heroes. Everyone that's working, who's a stay-at-home mom, who's a teacher, keep doing the right thing, because you all are truly the frontline heroes.
I think to summarize this, Wyoming's a big community. We need to band together. We're not panicking. We're saying this is what we're seeing now. It's time to jump into action to help each other. And take it seriously, listen to us, jump in and help us so that we can take care of the people in this county, because they're our priority. We're a referral center, but number one is taking care of Natrona County. And we have got to do that. So we're going to stay Wyoming strong, but you guys have to step up to the plate now and get there, get on your mask, and do what's right for everybody. And we'll take questions.
Yeah, so I was just wondering if you guys could kind of remind us, what is your total surge capacity? You're talking about patients are, 30, 40, 50, 60. Right. What's the worst case scenario?
Dr. Bleicher, can you repeat the question?
Yeah, so the question was, what is our surge capacity? And that of course depends on resources. We built the surge capacity prior to Banner, obviously back in March and April, and using every resource and every bed and doubling up with beds. So that's putting 2 COVID patients in multiple beds. We could get up to 220, which includes opening the East Campus, which would take more physicians than we have and more staff that we have. So on a regular day with single people in beds, when we're at 140, high 140s, that means every bed's full except for mom, baby. We have to keep that open because people are still having lots of babies. We have a COVID unit that we opened, and we have 5 patients in that now. We could expand that to 8, so that puts us, I don't want to use the word comfortable, but in the mid 150s to 160 without doing anything extraordinary. But beyond that, then it becomes putting patients together in rooms, figuring out how to open up East, and having to get staffing resources from Banner.
And if I could just ask a follow-up on that. So if you've got these 2021 patients in here right now, are we talking all people from Natrona? I'm asking because, we're hearing about hospitals in other states, Billings, in Utah, sending people, not being able to take on more patients from places like in rural Wyoming. Right. So if you could touch on that.
Sure. So the question is related to the COVID patients we have in the hospital. They all from the Natrona County, and commenting on other states, which has been national news, having inability to place COVID patients, etc. So I don't have the list in front of me of the 21. What I can tell you is that this morning, and we've been on red for, as I said, 48, probably almost 72 hours, and we've taken probably 10 to 12 COVID during that period of time, which means they've all been from Natrona County. So we're trending that way. And when we're on red, it means we'll take all traumas, all those heart attacks and strokes, but but other patients, if it's a sick, COVID patient from outside of our county, we do not have room right now.
I'd say 2 or 3 patients are from out of Natrona County. That's why we're having this today, to say this is exploding.
It's local.
I have a question from K2TV. What statistics are most important for people to pay attention to in order to tell how much worse or better things are getting?
I'll pass it to the public health people here.
So the question is, what statistics do we need to pay attention to in order to know where we're at? Am I right?
Yes.
You know, like, we are seeing the tip of the iceberg. I don't think that everybody who gets a cough in Natrona is going to get tested. So, so the total number that is being reported only is a fraction, in my mind, of what is going on. As far as what really is for us super important is our ability to take care of people. That means the hospitalization rate, how many people are in the hospital. We're having this discussion in this press conference today because we got to this point where we're full and we have 17 patients who need to be in the hospital and who are being held in the emergency room, which means that anybody else who comes to the emergency room is going to be held out in a hallway and or like some other contingency plans. The problem with COVID is that if we're going to wait until the number of the hospital, of the patients in the hospital goes up, we're 2 weeks behind. So right now, we are seeing the fruits or the problems that had actually started 2 weeks ago. If you look at the health department website, you can tell and you can see the exponential increase in the total number of COVID patients. And when you see that the curve went like from March this way, and then starting mid-September up, that upward trend was absolutely incredible. And as much as I want to give credit to everyone out there who's doing the right thing, there is a general sense in the community that I'm sick and tired of it. Let me just get it and get over with it. Well, that kind of attitude that is adopted by some people out there is having a very bad consequences on the rest of the community. So we really need to pay attention to everything. What we really need to pay attention to is that this is real and that we have to act now so that in 2 weeks, 4 weeks, 8 weeks, we don't get to the point where we can take care of everyone. And then you will have to start reversing the openings that you already have, which I don't think anybody wants to get there. Nobody wants to reverse any openings, but it may be something that at one point will have to be done. So let's just pay attention now. That's what I said.
Well, in addition, if you look at the positivity rate, or the number of positives in the rolling last 7 days, speak to what Dr. Ghanem was mentioning in terms of the slope incidence and prevalence. But it's still a good old-fashioned eyeball test. I can tell you now, patients saying the last couple of weeks, people are sicker. They just are. We've seen the respiratory symptom screening clinic. We've seen it in media care. Public health, a lot of different entities in outpatient settings are seeing sicker folks. In addition to the website that Dr. Ghanem referred to, John Hopkins has a great COVID resource site as well that gives really interesting statistics about each region, each state. That correlates very well with what the State Department, Health Department's doing.
So we as professionals look at all kinds of statistics that I wouldn't expect the public to look at. And I think the point they're making is that the positives that you see in the community, the number, it masks a lot of what's going on, huh? Pun intended, I guess. But we follow like doubling rate, which was like 90 to 100 days in the spring and summer, and then it went to 60, then it went to 50, then it went to 40, now we're down to 30 days that we're doubling our cases. Also looking at, which is a nationwide thing, looking at how many people per million are getting it, and we've gone from 100, 200, 300, which is tops. They want that well below 100. There's something called R0. There's all kinds of things that we're looking at, but all of them, as we mentioned, we're pointing towards this. We were all expecting this as professionals. It's about a week, 2 weeks earlier than we thought, but it's here, and because of all these back statistics, we know that this is going to continue. It's not going to, all of a sudden, people say, oh, it's just going to top off. No, we have enough data over this 6 months that we've been tracking it, that we know how it's spread, and even with the eyeball test, as Dr. Dunn mentioned, he can see it and feel it. We know by statistics that this is not going away. It is going to get worse, probably much worse before we crest.
So there's a site, go to the Wyoming Department of Health website, click on COVID, and scroll down, and you will see something that says 7-day average, 14-day average for the state. That's that's another place you can look. And you'll see we're going along, sort of at a level, and now we're up, straight up. It's pretty frightening to see, and that's statewide. So don't think that this is just a Natrona County thing. This is a state of Wyoming thing.
Yeah, so you mentioned there have been some staff exposures. Could somebody speak to how critical those exposures have been? You know, are you down a significant number of staff? Have you hired additional staff? Have you had to tap any of your partner facilities through Banner?
Great question. So the question's about the staff positivities with COVID and what we're doing to fill the holes and how critical the holes are. So just like all these other things, we're bumping along with 1 or 2 positive. I will tell you that despite us doing a significant amount of testing on patients that come in and evaluating them, there's still patients that get to the floor that are COVID positive that we don't know it for a day or 2. And our staff are not getting exposed. They're getting exposed, but they're not getting COVID that way. They're wearing masks. The patients are wearing masks. We're not spreading it. It's just another anecdote to show you that the masking does work. They're getting it in the community now, but we've gone from 1, 2, 3, 4, and we've spiked on that. We have 13, 8 that are out positive, 5 that are quarantined. So every staff member that we lose is critical. It's all hands on deck when you're code orange and you're calling your EOC, so we're moving people around. Working with Banner, we were able to get some travelers. We're getting 6 traveling nurses that will be here on Monday, which will be a huge boon. But with that EOC with Banner today, we're talking about is if this number keeps going, we're going to need even more staff, and will they be able to bring some up? And we're looking at with physicians, emergency privileging, et cetera, to be able to bring them, if possible, from Colorado.
Is that code orange status in Casper or through Natrona County as a whole?
That's a hospital
Oh.
term. Yep. Not a county. She was asking about the code orange, which is a hospital term for us.
Could you give a little bit of explanation of what that term means?
It's you know, 1 step below disaster. So we're not in a disaster. We didn't have of course, we don't have any tornadoes here, but we didn't have something like that happen. But it's just 1 step before disaster. Everybody needs to be here. Everybody's called from home to get here to talk and figure out what we need to do.
There's still an incredible amount of skepticism that all you have to do is go look at any story any of us does, and it's propaganda, it's fake news, it's, you know the drill. Are you just now talking to a brick wall about all this stuff, or is, I mean, aside from somebody in a family dying, what else can be done to break through this?
Right. So the question is regarding the skepticism out there about COVID and hoax and all that. And I can tell you, everybody at this table and every physician that I've talked to, and I know I've told the story a dozen times in the last 24 hours. Well, it's been 12 hours really. But it was a show on last night that said no masking. And they went on 20 minutes about saying how masks don't work. And gobsmacked is a phrase that comes to mind. We just cannot believe that people would say that masks don't work. when, you know, germ theory's been proven for years, and I invite those people to go to a hospital and ask their surgeon and nurses when they need an operation to not put their masks on. Right? Nobody would, you would, even somebody's fixing your wound in the emergency room, they'd have a mask on, what are you doing there? Well, a germ is a germ. Masks work, and so we don't understand the skepticism. There are obviously patients that get COVID that don't get sick. But we have 21 people upstairs, and I guarantee they're not all over the age of 80. There's younger people that get sick and are in the hospital receiving remdesivir, dexamethasone, oxygen therapy. We don't have the Regeron that Mr. Trump got, but they're getting everything else that's available. And people do get sick. It's sad to say that we need somebody in your family to get sick for people to pay attention. It's not, I hate the phrase, fake news. I mean, 200,000 people dead. We've had people die here. People that have chronic illness now because of this. It's a real thing, and it's, you guys have worked here a lot longer than I have. When's the last time we had a code orange and we couldn't handle the patient load? It's never happened. I mean, if we took away those 20 patients, we'd be busy. We wouldn't be having a press conference right now. That has tipped us over the edge, and it's going to get worse.
So to add to that, next week, the health department, in conjunction with the CARES funding that they have, will be unveiling our Casper versus COVID campaign, going at things a little bit differently, trying to get away from the skepticism. We do believe there is a large proportion of people that are doing the right thing, doing everything that they can. But that will be coming out next week, because as a community, as Dr. Dowell talked about, all of the people here, it's going to be a community response that we can turn this around. And so that information will be coming out next week. But it's more of a campaign of Casper versus COVID, because that's the only way that we're going to beat this.
I have a question from Facebook. Can you address herd immunity and whether, you know, the community can fight it that way?
I'm going to let the experts handle that. But the question's about herd immunity, and can we do that? In the history of the world, no pandemic has ever been solved with herd immunity. But you guys want to add to that?
So herd immunity is, the idea is like if you get people infected and immune, right? So that'd be it, right? And probably this is like, to get to herd immunity, you're gonna have to have 60, 70, 80% of people infected. And just do the math. And if you're thinking of like 1% right now, we're thinking mortality, maybe even less than that. Just do the math. And then you would know that there's gonna be a lot of people who are gonna be very sick in the hospital and potentially dying. What we're trying to say here is like, and we said this before, is let's flatten the curve. Everybody just like was on board to flatten the curve like a month ago. Right now we have an exponential rise, and this is when you actually have to flatten the curve. When things were actually bad in New York, it wasn't bad in here. And the curve wasn't that bad. But right now, it's bad in here. So to get to herd immunity is gonna be very painful. And we may get to herd immunity. We don't know that the vaccines are gonna actually be out there in 6 months or a year or whatever. But if we have 100 people showing to our emergency room tomorrow because they're exposed and they're sick, well, we can take care of 100 people. If we have 10 people, probably we can. It is this concept of kind of slowing down the infection that will give us the ability to actually do what we can do, which is treating people, having the antivirals, having the staffing to do it, having the hospital beds to do it, the oxygen, and everything else.
Think about how long Wyoming Medical Center's been here. These guys, 10, 20 years, no code orange. So we can take care of all the community heart attacks, strokes, cancer, all the most common causes of death. We don't come to you and say, we're full. And now we have 20 COVID patients. We can have 100, 200. And what is, how much population has been infected across the world? 1%, right? Not even 1% of the world has been exposed to COVID. So to think that we could get to 50, 60, 70% to develop herd immunity, it's ludicrous. I mean, I cannot imagine how overrun we would be if we didn't have all the good people in the community who are doing the right thing right now. If everybody didn't wear a mask and blew this off, 100, 200, 500 people in the emergency room right now?
The estimates nationally with herd immunity, depending on what number you pick, very good statistical models, 2.5 million Americans dead at a minimum. Is that worth it? Not a chance. It's bad enough to have 200,000. And that number is going to keep going up. Remember, one thing I didn't emphasize, and all of us are aware of this, it's not cold yet.
Kind of cold today.
Yeah, be a man. But it's not cold yet, so people aren't inside. This virus loves people in a closed space. This virus just loves getting that chance. So as the weather turns cold and we're all inside, this is when you socially distance. This is when masking is 3 times as important. This virus will spread like crazy. It's not as contagious as measles, but it's certainly a lot more contagious than a lot of other viruses.
Sort of follow up to that, Dr. Dowell. I was looking at the CDC website yesterday. From what I understood, influenza season hasn't really started in the country. How, as that gets started, if it does, will that exacerbate the situation? And do you have any projection about how that's going to look here in this area?
The question is, what role is influenza going to play when it hits? We typically have influenza hit the state, depending on the year, anywhere from late December to April. October is influenza immunization month in this county, and we try to make it in the state. It's going to be a nightmare from trying to figure out what is influenza, what is COVID, what is both, what is neither. How do you get access to all the testing you need to sort it out? Who do you test? It's gonna fall on the respiratory clinic. And I'm glad you bring that up because it's something we haven't touched on. We're gonna call on the state to immunize the heck out of everybody against influenza. Anybody over 6 months of age. We have to. That way we'll have a better chance to sort out what is COVID and what isn't. It's so important. And there's even a little anecdotal information that influenza vaccine may help protect just a tad against COVID. So there's a lot of reasons to do this. And if there was ever a year to immunize your family, it's now.
Yes, back to the thing when you were saying is what we were seeing now happened 2 weeks ago, what we'll see 2 weeks from now is happening now. In the contact tracing or other things, can you point to like specific gatherings where a whole bunch of people weren't wearing masks? I mean, is there any particular loci of where this sort of thing may have started?
So I think a lot of the things that we're finding out is it's very much in the community. We're not able to tie it back. We can tie some things back to businesses or staff members that work in different places. But as far as like large gatherings, we have not been able to tie that to anything in recent events or anything like that. I know there are a lot of things that happen in our community that we don't necessarily know about, but we work very closely with the event center, the school district, the college. They're some of our best partners because they're trying to take all of these things into consideration and doing what they need to do to be as safe as possible.
Dorm at Casper College
So the
would be an example.
So the dorm at the Casper College, obviously we're doing very proactive testing with them. They are working extremely hard to make sure that a congregate setting, of course, that's a prime place for new infections to be and easily spread. yep, it's a younger population that may not get sick, but the volume that we see, but we are actively working with them daily to ensure that we're controlling as much as possible.
And one other thing to consider, we're entering fall. So spring, summer, different season, different activities, different events. And now we're coming to indoor activities, closer groups, whatever. So really, it's been trended thus far. We can't hold, we can't project that going forward. We know that you should be boring. The next couple of months, be boring. Stay home. Don't do things. Do board games. Be boring. That's what's going to help. So when we talk about different clusters, epicenters, whatever, we're coming into a season which we haven't had COVID before. So it's going to be very, very interesting to see what indoor activities lend to. So please be boring.
And as I said earlier, we're in all of our long-term care facilities, assisted living facilities, some of those congregate settings with our vulnerable populations. They are actively testing their staff and patients weekly. We're doing everything we can to help them. It does affect their number of staff that they have working there, so it's kind of a combination of everything. It's community spread.
I think this is probably a question for Anna as well. You mentioned that there's some resistance in contact tracing efforts. Could you characterize to what degree you're seeing that resistance? Is it quite a bit? Is it, more of a fluke?
I think the biggest thing that we're trying to stress is that when people go for testing, that they give a good, strong phone number. Even if they ask the healthcare provider, are you sure you got my phone number right, or restate their phone number, would be extremely helpful. So having a good contact information is essential. But when you get a phone number that you may or may not recognize, which I know all of us up here probably get those phone calls, we don't know who it is, we don't answer. Perhaps you might want to answer that phone call or call us back. We will do everything we can to walk you through the process. But biggest thing is we're seeing is people just aren't, and talking about their contacts, no one's getting in trouble. There is nothing that we're looking for in a punitive way. It's just, if you can really think about who you had contact with for the last 2 days, really hard, and identify all those people, it's protecting all of them. It's not a means of punishment or anything like that.
So I just want to touch base on this a little bit. So I don't know if there's a stigma that is being out there about people who are having COVID. Like, oh, you have not been doing what you really need to do, that's why you got it. And if that's the case, that's absolutely not true, because most people actually, a lot of people just have a mask on. It's the person who doesn't have a mask on that actually transmits it. So this is not, for me, doesn't protect me. So if I get COVID, that doesn't necessarily mean that I've done anything wrong. There is no right and wrong. It's not a prejudgment. We're not judging people. And that's important to just put out there. All what we want is to protect this community and to decrease the rate of transmission. What you do in your own house, what you do in the community, you're responsible for that. So just be responsible. That's all. There's no judgment.
Just to follow up on Morgan's question about contact tracing, I know the state activated the National Guard to help out with those contact tracing efforts. Do you guys have enough people helping you with contact tracing? What is the challenge on that aspect of it?
So at this time, we have not activated bringing in the National Guard to help us. We really want to keep it within our community so we can work with our healthcare providers, we can work with the hospital, so that we know exactly what's going on. No disrespect to the National Guard, they will do an amazing job, but we really want to bring the community perspective of that, and we made that decision early on with the county health officers that we would want to keep things together. Absolutely, when we get 30 plus cases overnight, it is hard to get to everybody. We do our very level best, but if someone isn't contacted, it's usually because the phone number is incorrect. I know we work with Dr. Dunn extremely closely, always trying to figure out what that is. The other thing is we have a lot of other people that are doing testing in the community, reporting that to the state. We can't initiate or we can't move until we get that information from the state. So if you test at a facility, they then have to report that to the state, and then the state gives it back to us to know that that person, needs to have contact tracing. So, I mean, that can increase the number of days as well. So, we're just asking for help from people to answer their phone, give us detailed information, and really, like, we're just trying to, figure out the full circle to protect everyone.
Just a couple more questions. We'll wrap it up.
Yeah, I do have one more. I was kind of hoping Dr. Dowell would be here, but he and Dr. Ghanem were talking to the school board this summer about, the goal is to keep students in school as long as possible in buildings. But how bad does the situation get before something like that changes?
I think the school district has done really an amazing job. And I think there have been cases, as you know, in schools. And it could have been way worse if people were not masked at school. We continue with the same policy. We want our schools open. It is very vital for our community. We will not in any way push the other direction unless it's absolutely necessary. I do not know that right now there are any criteria that are developed or discussed to do this. The state has also weighed in that, and right now there are no plans at all to shut down any schools or to reverse the opening. But this is why it's important. If our level of transmission in the community gets to be very high, and then the epidemic really gets out of hand, we cannot have a choice. We don't want it there. And that's why we're having these conversations.
Again, something to be proud of in our community, with the school cabinet, and the board, Natrona County School, and the other schools, quite frankly, have done frontline heroes again. We meet with them once a week, once every 2 weeks, whatnot, and they're doing a great job. So something to take pride in and to continue to support.
Okay, last question.
Yeah, so, this is about the transfer situation. I'm sorry, I don't quite remember the term. Is it a code red for the transfers, or?
Oh, code red, she's asking about, code red for, when we're not accepting transfers from outside the county.
Right, so in that situation, is that something where, if you guys get a transfer request, the, WMC helps facilitate locating another bed for them, or is that the responsibility of the, home hospital of that?
Yeah, we all work, so she's asking about if it's a code red and we can't take the transfer, do we help facilitate? Absolutely, we'll facilitate to other banner hospitals and or other hospitals, so that's always been in the works. Sometimes if there's a higher level of care that's needed, we've always done that, so yeah.
So where have those patients been being transferred in the last 72 hours or so?
I don't have that in front of me right now, so I couldn't tell you. Usually they go, it depends where they're from and what their issue is. They go to Utah, they go to Colorado, just depends.
But out of state?
Most often, yeah.
Okay, thank you guys very much.
Thanks everybody for coming and helping us get the word out, we appreciate it.